That's why today we're announcing a Stop the Spread testing initiative, which will begin on Friday, July 10th, and run for the next 4 or 5 weeks. No one needs to rush to any of these test sites. They're going to be open and available to people, as I said, through the middle of August. We're launching this program in 8 specific communities where the prevalence of COVID-19 is above the statewide average and where we've seen a decrease in testing volume since April. The goal of this initiative is to provide widespread asymptomatic testing in an easy-to-access location within these communities. Increased testing within these communities will help to identify new cases of COVID-19 and help stop community transmission. It will also provide people with a certain sense of comfort if they do believe that they may have been exposed or otherwise believe they need to be tested. The 8 municipalities selected for these free testing sites show the most specific need at this point in time based on 4 metrics. We analyzed data from all 351 cities and towns, looking for areas that had elevated total spread, elevated spread over the past 2 weeks, high positive test rates for the past 2 weeks, and declining test volume since the end of April. This initiative will be launched at the end of this week in Chelsea, Everett, Fall River, Lawrence, Lowell, Lynn, Marlborough, and New Bedford. The testing initiative, as I said, will run for 4 or 5 weeks in these locations, and we urge people in these communities to take advantage of the availability of these test sites, even if they don't have symptoms. Collectively, these communities make up approximately 9% of the Massachusetts population, but have seen 27% of the Commonwealth's positive tests in the past 2 weeks. The statewide positive test rate over the past 2 weeks, as I said before, is a little under 2%, but in these 8 communities, 8% of the tests there have been positive. That includes some individuals who've had multiple positive tests. Despite the continued elevated spread in these communities, total testing in these communities has actually declined by about 40% since the end of April. By boosting testing in these communities, we can more effectively drive contact tracing efforts and support there. This will enable people who test positive to appropriately isolate with supports. It will give them somebody they can talk to about how to manage their time during this period, and it will also help us trace their close contacts and encourage those folks to get tested and to then isolate if they test positive with supports as well. As I said, the initiative will run for the next 4 or 5 weeks, which is basically going to run through the middle of August.